You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello. Thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about lifting weights and strength training during your pregnancy. Strength training offers significant benefits for both your physical and your mental health. But a lot of expecting moms wonder whether lifting weights is safe during pregnancy. While we have extensive research on exercise when you're pregnant, specific studies on strength training are more limited. In today's episode, we will examine what the evidence tells us about strength and resistance training during pregnancy. You will learn how pregnancy-related changes can affect your strength training or lifting workouts, what precautions to take, and how to modify exercises safely. Whether you are an experienced lifter or you're new to resistance training, this episode will help you approach strength training during pregnancy with confidence. You can find the full article and all of the resources for this episode at pregnancypodcast.com/strength. You are on the public feed of the podcast, which means you get ad-supported content from the last year. Become a Pregnancy Podcast Premium member for an ad-free experience, plus access to hundreds of episodes that cover every topic you could possibly imagine for pregnancy and birth. Let me save you the time and hassle of sifting through information online, trying to reconcile conflicting advice. For whatever topic you're looking for more information on, there's an episode of the Pregnancy Podcast with all of the information you need. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. As the #1 baby monitor brand in North America, VTech is trusted by millions of families. The Advanced HQ Max is built for parents that want an easy-to-use, secure monitor without the need for Wi-Fi or apps. Save 20% with the code VTPodcast20 and check out the VTech Advanced HQ Max at pregnancypodcast.com/HQMax. Eat Sheep Organics makes amazing 100% clean, natural pregnancy products. From skincare to treating common symptoms like stretch marks with clinically proven ingredients, Eat Sheep Organics has you covered. Plus, every product comes with a 100-day happiness guarantee. If you are not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. There is a separate episode that provides an overview of exercise during pregnancy. That episode covers general recommendations, safety considerations, and how pregnancy-related changes and common symptoms can affect your workouts. That really lays the foundation for understanding how to approach exercise during pregnancy. So I recommend listening to that first before diving into this episode on strength training. And this episode is the final installment on a series on exercise during pregnancy. We also had episodes specifically covering cardio and yoga. What is strength training? This is a form of exercise that increases your muscle strength. And when most people think about this, they picture lifting weights at a gym, but the category is really much broader than that. Strength training includes resistance bands, kettlebells, machines, body weight exercises like pull-ups, push-ups, and squats. Even plyometrics and certain styles of yoga can fall under the umbrella of strength training. The key is that these exercises challenge your muscles against resistance, whether that resistance comes from free weights, your own body weight, elastic bands, or a machine. There is a substantial body of evidence on the benefits of strength and resistance training for both physical and mental health. Strength training positively benefits your metabolism, reduces body fat, improves physical performance, improves insulin sensitivity, reduces the risk of type 2 diabetes, and promotes bone development and density. Beyond all of the physical benefits, strength training can reduce symptoms of depression, boost self-esteem, and even enhance cognitive function. Strength training becomes even more important as we age. Muscle mass decreases 3 to 8% every decade, starting in your 30s. After age 50, muscle mass loss increases to 5 to 10% per year. This decrease in muscle is accompanied by a reduction in resting metabolic rate and increased fat accumulation. Maintaining muscle strength now, while you're in your childbearing years, and beyond that can help counteract these long-term changes. One study specifically examined strength training during pregnancy and found that it decreased fatigue and increased both physical and mental energy. A systematic review of 61 randomized controlled trials examined the effects of different types of exercise on maternal health. The researchers found that the exercise modality that was the most favorable on maternal health was a combination of aerobic and resistance exercises. Basically, combining cardio and strength training appears to yield the best outcomes during pregnancy. Even the American College of Obstetricians and Gynecologists acknowledges that the literature on strength training during pregnancy is sparse. ACOG attributes the lack of research on resistance training to not being considered a safe activity in early guidelines for exercise, and this was due to concerns about potential injury and possible fetal heart decelerations. As a result, many of the early studies focused on other forms of exercise, which left a gap in our understanding of strength training specifically. While there's a lot of research on exercise during pregnancy, relatively few studies examine strength training. One small study showed that low to moderate strength training is safe during pregnancy. In this study, the training included a 45-minute session of 5 exercises with 2 sets of 15 reps each. The exercises were all performed on machines and included a leg extension, leg press, arm lat pull down, leg curls, and a lumbar extension. The participants experienced no adverse effects. A larger study with 160 women found that light intensity resistance training and toning exercises performed in the 2nd and 3rd trimesters do not have a negative impact on the newborn's size or overall health. This is important because one of the theoretical concerns about exercise during pregnancy is that it could redirect blood flow away from the baby, which could potentially affect growth. And this study found no evidence of concern with light intensity resistance training. One study found moderate to vigorous resistance exercise to also be safe during pregnancy. The study used a modified version of body pump workouts that involves high repetitions with lightweight barbells. Sessions were 1 hour, including a warm-up and cool-down. To modify the workouts for pregnancy, squat jumps were exchanged for heel raises, squats were performed with less depth, and abdominal training was replaced with pelvic lifts and static abdominal exercises. This study demonstrates an important principle, which is you can modify almost any exercise to make it appropriate for all of the changes that are happening in your body and how you feel. The overall takeaway from all of the research is that low to moderate intensity resistance training appears safe during healthy pregnancies. Of course, we need more research on higher intensity strength training, and there's not a lot of research on resistance training in the 1st trimester, but all of the available evidence is encouraging. Before we really get into practical tips and precautions, it's helpful to understand how pregnancy changes your body in ways that directly affect strength training. Being aware of these changes can help explain why certain modifications may be recommended or may feel necessary as your pregnancy progresses. First up is relaxin and joint stability. The hormone relaxin increases during pregnancy. This helps loosen ligaments in preparation for birth. Your ligaments are the connective tissues that help keep your bones, your joints, your organs, everything in place. If you stretch a ligament too far or tear it, the resulting injury is a sprain. The effects of relaxin on the pelvis is really great for birth, but the increase in relaxin also affects ligaments throughout your entire body during pregnancy. This means that your joints have less stability and it's easier to overstretch your ligaments, which can cause pain or injury. When you are strength training, the increased joint laxity means that you have to be more mindful of your form and avoid movements that can push your joints to their maximum range of motion. So what that means is that what feels stable and controlled before pregnancy may feel looser or less secure as your pregnancy progresses. Your growing belly will also present some challenges for strength training. As your uterus expands, it puts more pressure on your vena cava. This is the main vein that carries deoxygenated blood from the lower half of your body back to your heart. If there is significant pressure on this vein, it can decrease blood flow, which could ultimately reduce oxygen delivery to your baby. And this concern has been raised particularly regarding spending long amounts of time on your back. So sleeping on your back, or if you were exercising in a supine position. A systematic review examined whether prenatal supine exercise is associated with adverse outcomes. The researchers found that although many countries caution against supine exercise after 16 weeks of pregnancy, these recommendations are primarily based on expert opinion rather than explicit scientific evidence. Overall, the researchers concluded that supine exercise is not associated with adverse pregnancy outcomes, but they do note there's insufficient evidence to definitively determine whether exercise in the supine position is safe or whether it should be avoided during pregnancy. It's important to recognize there's a big difference between spending several hours lying on your back and lying on your back for a few minutes to complete an exercise. You can also modify some exercises so that you're not completely flat on your back, so you're more of an incline position. Or if you're planning several exercises or several repetitions in that supine position, you can mix up your routine and alternate positions so that you have breaks between sets that require you to be on your back. The most important factor is how you feel. If you feel lightheaded, nauseated, short of breath, or uncomfortable while you are on your back, then that is a clear signal to change position. Your growing belly may also limit which machines or positions you can comfortably use. It will become uncomfortable to lie on your belly or to have your belly resting against a machine. If you're doing push-ups, you don't want to start lying on your belly. Plus, you may not be able to lower all the way to the ground without putting pressure on your abdomen. If you are lifting weights in front of you, be careful when you're holding weight further away from your body, because that increases your risk for injury. Your growing belly can also throw off your center of gravity, which can affect your balance in certain exercises. If you are an experienced lifter, then you probably know what the Valsalva maneuver is. In the past, doctors thought that the Valsalva maneuver during pregnancy could reduce blood and oxygen flow to the baby. And this is one of the reasons why some medical providers advised against strength training when you're pregnant. The Valsalva maneuver is a breathing technique that's commonly used during heavy lifting. Generally, you take a deep breath into your belly before the repetition. Then, during the most strenuous part of the rep, You exhale with your glottis closed so that no air escapes. Your glottis is a structure in your windpipe that controls the flow of air in and out. After the most challenging part of the lift, you exhale fully. What this breathing technique does is it creates pressure in your abdominal and thoracic cavities, which can help stabilize your spine and reduce the load on your back. The concern was that this increased intra-abdominal pressure could affect blood flow to the placenta. However, we do have more recent research that uses 3D Doppler ultrasound, and it shows that placental blood flow does not decrease during the Valsalva maneuver. If this is a technique that you use as part of your lifting practice, this is reassuring news. That said, if you are new to strength training, you don't need to start incorporating the Valsalva maneuver. You can just focus on maintaining steady breath throughout your lifts. You also have considerations for your core and your pelvic floor. Your core is not just your abdominal muscles. It also includes your diaphragm, back muscles, and your pelvic floor. All of these muscles work together to manage pressure inside your body and to support movement. As your pregnancy progresses and your belly grows, your abdominal muscles will stretch to accommodate your growing uterus. In some cases, the two sides of the rectus abdominis muscle can actually separate slightly along the midline. This is a condition called diastasis recti. This is a normal adaptation to pregnancy, but it does change how your core functions. When strength training, avoid exercises that cause your belly to dome or bulge outward, because that can place additional stress on the abdominal wall. Instead of doing traditional crunches or sit-ups, focus on exercises that maintain a neutral spine and engage your deep core muscles without creating excessive intra-abdominal pressure. Modified planks, standing exercises, and movements that incorporate breathing can all support core strength without exacerbating abdominal separation. Your pelvic floor also deserves attention during strength training. The pelvic floor muscles support your bladder, uterus, your bowel, and during pregnancy, these muscles are under increased strain because of the weight of your growing belly and all the hormonal changes. Heavy lifting or exercises that create a lot of downward pressure can stress the pelvic floor further. Signs that you may be placing too much strain on your pelvic floor include leaking urine during exercise, a feeling of heaviness or pressure in your pelvis, or pain during or after certain movements. If you experience any of these symptoms, it's worth consulting with a pelvic floor physical therapist who can assess your specific needs and provide targeted exercises. Next, we're going to cover lifting heavy objects, cover some warning signs that you should keep an eye out for, and ways that you can modify your workouts. Before we do that, I want to thank the sponsors that have supported today's episode. A lot of companies have exclusive discounts for pregnancy podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. VTech is the #1 baby monitor brand in North America, and they're trusted by millions of families to deliver crystal clear HD video, reliable performance, and strong night vision. The Advanced HQ Max is built for parents that want an easy-to-use, secure monitor without the need for Wi-Fi or apps. It has a large 7-inch screen and crisp real-time video, so it provides reliable monitoring without the lag. There's a secure no Wi-Fi operation, so you don't need apps or internet. You can remotely pan, tilt, and zoom. It also has a multicolor adaptive nightlight, built-in soothing sounds and lullabies, temperature sensor with alerts, motion detection notifications, two-way talk and infrared night vision, plus a private 2.4 gigahertz connection with an encrypted signal. The Advanced HQ Max is perfect if you want private, no-fuss monitoring with premium features. Save 20% with the code VTPodcast20 and check out the VTech Advanced HQ Max at pregnancypodcast.com/HQMax. AG1 is the daily health drink that combines your multivitamin, pre- and probiotics, superfoods, and antioxidants into one simple green scoop. It's one of the easiest things that you can do to support your body every day. AG1 goes to very great lengths to continuously invest in rigorous peer-reviewed clinical trials. You know how much I love research. Plus, they go above and beyond to test for hundreds of contaminants and impurities to guarantee that they deliver the highest quality nutrients available. I have been starting every morning with AG1 for years. My favorite thing about it is the peace of mind, because I know that I'm covering all of the key nutrients my body needs. I'm supporting my microbiome, metabolism, and my immune system. And this time of year, it's more important than ever to be proactive about supporting your immune health. Head to drinkag1.com/pregnancypodcast. And when you first subscribe to AG1, you'll get an AG1 welcome kit, a bottle of vitamin D3K2, and you'll get to try each new flavor of AG1 and their new sleep supplement, AGZ. Go to drinkag1.com/pregnancypodcast. As a friendly reminder, pregnant or nursing women should seek professional medical advice before taking this or any other dietary supplement. Let's get back to today's episode. While ACOG doesn't get into much detail on strength training, they do address lifting in relation to occupational considerations. That would apply if you work in a job that requires you to lift items regularly. ACOG states that lifting in particular poses a risk of musculoskeletal injury and low back pain during pregnancy. The National Institute of Occupational Safety and Health has developed recommendations specifically for pregnant workers. I'll link to those recommendations. These limits are based on a lot of variables, like where you are in your pregnancy, the height of the lift, the distance from your body that the item is held, and how frequently you are lifting. And the weight limits are very low, especially for lifting from below your waist. Unfortunately, it does not work to extrapolate the workplace guidelines directly to weightlifting or strength training. Lifting a heavy box that you have to hold far away from your body is very different than lifting a dumbbell, kettlebell, or barbell in a controlled gym environment. Workplace lifting often involves awkward positions, repetitive strain, unpredictable movements, whereas if you are strength training, you're using proper form, the movements are very controlled, and typically it's a gradual progression. That said, the principles behind workplace lifting safety would still apply if you are lifting heavy things in the workplace. You want to keep the weight close to your body, avoid twisting, use your legs rather than your back, and listen to your body. If a weight or a box or anything you're lifting feels too heavy, or you feel strain in your back or your pelvis, definitely reduce the load. One thing to keep in mind is that experience level matters. There's a significant difference between someone who has been strength training for years and somebody who is just starting to incorporate weights into their exercise routine. Your experience and comfort level with strength training will affect how you approach these exercises during your pregnancy. If you have been lifting weights regularly before pregnancy, you can generally continue with modifications. Your body is already adapted to the movements. You probably understand proper form. You may have a baseline sense of what feels right for your body. As your pregnancy progresses, you may need to reduce weight or adjust your range of motion, or modify certain exercises, but the foundation is already there. If you are new to strength training, pregnancy is probably not the time to jump into an advanced lifting program. That does not mean that you should avoid strength training, but it does mean that you should start conservatively. Focus on learning proper technique and build gradually. Working with a knowledgeable instructor or trainer, especially one that has experience in training pregnant clients, can be very helpful. Regardless of your experience level, you should be using weights, bands, or machines correctly to prevent injury. There's a lot of resources that are available to help you learn proper lifting techniques. The best resource is to have someone in person. That way they can observe your form and provide real-time feedback. This could be a personal trainer or an instructor at your gym if you have access to that. It could also be a friend who is really knowledgeable about strength training. Many gyms also offer group classes so that an instructor is available to assist with technique. A group class tends to be much more cost-effective than one-on-one personal training. Let's cover warning signs related to strength training. Most of the warning signs that indicate that you should stop any exercise are very obvious. The list from ACOG includes regular painful contractions of the uterus, bleeding, fluid gushing or leaking from the vagina, feeling dizzy or faint, shortness of breath before starting exercise, chest pain, headache, muscle weakness, calf pain, or swelling. Paying attention to your body and how you feel is really the key to keeping your workouts within safe limits. If you feel excessively fatigued, overly winded, you're uncomfortable, that's a signal to slow down or stop. You may also need to modify your training as your pregnancy progresses. What felt very manageable or weights that felt very light in your first trimester may feel more intense later, and that's completely normal. Listen to your body, and if you feel like you may be overdoing it, you probably are. Now that you understand the research, the physical changes that can affect strength training, let's cover some practical tips to help you train safely and effectively during pregnancy. First, focus on proper form. I talked about this a little bit already. This is even more critical during pregnancy because remember, your joints are less stable and your center of gravity is shifting. Good form maximizes the benefits for your muscles and helps prevent injuries. If you are not confident in your ability to perform an exercise correctly, do not do it, or seek instruction from somebody who is knowledgeable before you attempt it on your own. You can modify almost any exercise to work for your changing body. So let's talk about some practical modifications you can consider. One is you can switch free weights for resistance bands if holding weights feels uncomfortable or unstable. You can also decrease the weight and increase repetitions. That would allow you to continue building strength without placing an excessive load on your joints. You may need to adjust your range of motion. You do not need to go through a full range of motion if it feels uncomfortable. For example, you could perform squats to a shallower depth, which can accommodate your growing belly. You may consider using machines instead of free weights if you feel less stable with free weights. Machines tend to provide more support and control. If you're doing push-ups, you can modify those by performing them on an incline, which would be putting your hands on a bench or a wall rather than directly on the floor. This reduces pressure on your belly and will make the exercise more manageable as your pregnancy progresses. Last tip to modify exercises is to skip exercises that involve lying on your belly or that require you to hold your breath for extended periods. One exercise that you should be embracing is squats. Squats are probably the best exercise you could do during pregnancy. They strengthen your legs, glutes, and your core, all of which support the physical demands of pregnancy and labor. The more squats that you do during pregnancy, the more comfortable you will be in a squatting position during labor, and the longer you will be able to maintain that position comfortably. There is evidence that being in an upright position, especially in a squat, is beneficial during labor and may even shorten the duration of it. If you want to get squats in now, those can be performed with just your body weight alone. You could also add resistance with dumbbells, a barbell, or resistance bands. If you're new to strength training, start with lighter weights or just start with body weight exercises and then build gradually. If you were already strength training before you got pregnant, you may need to reduce your weights as your pregnancy progresses, or you may not be going up in weights as rapidly as you were before pregnancy. This is not a step backwards. Remember, your body is doing a huge amount of work to grow a baby, and adjusting your training to match your body's current capacity is a smart choice. Some days you will feel strong, other days you may feel more fatigued or uncomfortable. And that's normal. On days when you feel good, you can push a bit more. On days when you're feeling tired or more off, you can scale back. Consistency over time matters much more than any single workout. And during pregnancy is probably not the time that you're going to be pushing for PRs. A few more tips before we wrap up this episode. One is to consider recovery. Strength training breaks down muscle fibers, and your body rebuilds them stronger during rest. Adequate recovery is essential, especially during pregnancy, because this is a time when your body is already working hard to support your growing baby. Make sure that you're allowing enough time between strength training sessions for your muscles to recover. For most people, this means strength training 2 to 4 times a week with rest days in between. As with any exercise during pregnancy, hydration and nutrition are very important. Drink plenty of water before, during, after workouts. If you strength train regularly, you may need additional calories to support both your activity and your pregnancy. Pay attention to hunger cues and make sure you're eating enough to fuel your workouts. Your strength training routine will likely change as your pregnancy progresses. In the first trimester, many women can continue their pre-pregnancy routine with minimal modifications. Although things like fatigue, or if you're dealing with morning sickness, may require that you reduce volume or intensity. In the second trimester, as your belly grows and your center of gravity shifts, you may need to modify exercises that involve lying on your back, balance challenges, or deep bending. Then in the third trimester, you may find that you need to reduce weight further, focus more on body weight exercises. Remember, your body is going to weigh much more in the third trimester than the first trimester, and prioritize movements that feel comfortable and sustainable. There's no single right way to progress through pregnancy. The key is really to stay attuned to your body and adjust as needed. You should, of course, discuss your exercise and activity with your doctor or midwife and take into account your experience level and the specifics of your pregnancy. If your care provider has reservations about strength training exercises that you feel comfortable doing, take the time to talk through their concerns and ask for clarification. Understanding the reasoning behind their guidance can help you make informed decisions. If you are new to strength training, working with an expert who can assist you with proper technique is invaluable. Many personal trainers and instructors have experience working with pregnant clients and can help you design a safe and effective program. Whether you are an experienced lifter or just starting out, you can modify almost any strength training activity to feel empowered to train safely during pregnancy. To recap today's episode, we talked about lifting weights and strength training during pregnancy. I covered some research on the benefits of strength training, not just for your physical health, but also for your mental health. We went through available research on strength training during pregnancy, covered the physical changes during pregnancy that can impact strength training, things like relaxin and joint stability, how your growing belly may alter your workouts. I talked about the Valsalva maneuver, went through some considerations for your core and pelvic floor, touched on the warning signs that you should keep an eye out for, and then we went through practical tips for strength training during pregnancy. Things like focusing on proper form, that you should be embracing squats during your pregnancy that will actually help you in your labor, and supporting your recovery, staying hydrated, making sure that you're getting adequate nutrition, and wrapped up with a friendly reminder to talk to your doctor or midwife. I'd like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share this episode if you have a friend who's pregnant that you know likes to lift weights. So many listeners discover the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/strength. If you're looking for more evidence-based information, or you just want an ad-free experience, check out Pregnancy Podcast Premium. Premium members get access to hundreds of episodes with evidence-based information you won't find anywhere else. Check it out at pregnancypodcast.com/premium.